Welcome to Domain 2 Essentials, Federal Requirements with Zipporah Redding-Christian. Zipporah Darby is a seasoned pharmacy technician, certified allied health instructor, and award-winning healthcare professional with more than 15 years of experience serving patients and developing future technicians. She's known for her clear, confidence-building teaching style that helps students master pharmacy calculations and real-world workflow with ease. As a speaker, educator, and best-selling co-author, she brings leadership insight, practical wisdom, and an encouraging presence to every stage and classroom. She's trained and mentored countless pharmacy technician students, empowering them to excel academically, professionally, and personally. She's committed to elevating the pharmacy technician profession by equipping the next generation with excellence, integrity, and purpose. Please welcome Zipporah Darby Redding-Christian.
Greetings. Welcome to the Pharmacy Technician Student Summit 2026. Today's presentation is going to be on Domain 2, Federal Requirements, preparing for the Certified Pharmacy Technician exam. I am your presenter, Zipporah Darby Redding-Christian. I am a registered and certified pharmacy technician, as well as a certified allied health instructor. I am also an educator, so I'm super excited to present this presentation to you today. A little bit about myself. I am a multiple award-winning pharmacy technician. I'm an educator with over 15 years experience. I have different skill sets in my background. I've gone and been in community care pharmacy. I've done long-term care pharmacy. In addition to being in academics, I'm also a professional development consultant and a motivational speaker. I'm truly dedicated and passionate to empowering others with tools and strategies to excel in their careers. So happy to have you. In regards to disclosures, I have no vested interest in or affiliation with any other corporate organization offering financial support for this continuing education activity. So for today, the learning objectives is listed. By the end of this presentation, attendees will be able to recognize the major topic areas tested on the certification exam for pharmacy technicians, including controlled substances, prescription requirements, and technician scope of practice. Attendees will be able to analyze scenario-based questions and choose the most appropriate legal compliant response. Attendees will be able to identify required elements of a legal prescription and recognize when information is missing or invalid. Attendees will also be able to use mental frameworks, an example, recognizing which part is safety, legality, and scope, to confidently select the best answer. Listed is the session's roadmap. Throughout this entire summit, this is the framework that is listed so that you'll know what to expect. We're going to first start off in orientation and the exam framing. Then we're going to do a domain at a glance and get an overview of that. We'll then be talking about the high yield concept buckets and things that you should look out for. We'll be talking about the common exam traps, things that you can prepare for and what to keep in mind. And then we'll follow through with a rapid knowledge check, answer some questions, and then do a final anchor and some takeaways. So let's first go ahead and get into the orientation and framing of this presentation. So what is Domain 2? Domain 2 is federal requirements. On the exam for certification, it's moderate. It is weighed at 18.75%. Commonly, the exam portion for federal requirements focuses on controlled substances, DEA regulations, prescription validity, technician scope of practice, as well as drug safety and recalls. Basically, this particular domain shows up as what is the safest, what is the most compliant next step. This is what you can keep in mind. So how does Domain 2 really appear on the exam? Well, it appears in various question types. It could be scenario-based questions, definitions, questions that pretty much ask what's the best action that a technician should take. There are going to be some decisions that you'll have to really check to see which one is going to be better. Think of it based on laws versus the role that a technician would play. It'll also be putting some differences of identifying what's legal versus illegal actions. You will need to be familiar with some DEA rules, and then there is some occasional math that is tied to compliance. So we'll be able to get into some of those during this presentation. Overall, when it comes to the domains at a glance, there are 4 primary domains. One is medications. It holds about 35%. I already talked about what we're going to be talking about today, federal requirements. You also then have patient safety and quality assurance. And then you have domain number 4, which is order entry and processing. So let's go ahead and get into the high yield concept buckets. So when you think of federal requirements, we need to think of the bigger picture. During this presentation, if you don't remember anything else, definitely focus on these 6 buckets, which are, we're going to be talking about medication storage, handling, and disposal, which could depend on the classification of a medication. The rules as it relates to DEA and controlled substances. Inventory, we're talking the proper techniques to receive, storage, and what happens if there is loss of a medication. Continuing with things that's in the bigger picture, the restricted drug programs such as REMS or the restriction to pseudoephedrine. We'll be talking about hazardous and pharmaceutical waste. And then we'll be talking about the FDA oversight based on recalls and as well as HIPAA. So our first high yield bucket that we want to pay attention to is the medication storage, loss, and disposal. So this is 2.1 of the domain. So when you think of hazardous material, we want to make sure that those are being discarded properly. Examples of hazardous waste could be nitroglycerin, warfarin. So we want to make sure that those are being disposed of properly. For non-hazardous waste, remember, no waste that is medication should ever go in the trash. It should be properly disposed. So some key phrases to be familiar with when it comes to domain 2.1 is perpetual inventory. If there is loss of medication, you want to definitely make sure you remember the DEA form 106. And so basically, when we're talking about medication storage, the exam is basically asking who must be notified and then how fast should the notification happen. So we want to make sure that when there is medication storage, we want to make sure we're handling medications properly. If something needs to be refrigerated, knowing which items are primarily refrigerated, and then knowing which ones can be room temperature. So that's why it's important that we understand proper storage and disposal is required. So now that we talked about a little bit of medication storage, loss, and disposal, let's continue talking about what are some legal requirements. So you have to make sure that all medications are stored properly. That is also going to include making sure that there is no diversion, making sure that there is no theft. So if there is significant loss, then that's when DEA form 106 will be filled out. For inventory, in pharmacy, we know that the controlled substances, especially C2s, are placed in a different area versus the other C3 through C5, which in some pharmacies are along with the other medications that's non-controlled. And then we always want to make sure that if there is disposal, that you notify the pharmacist. So now that we talked about the high yield bucket number 1, we're next going to go into the high yield bucket number 2. Let's discuss controlled substances and DEA rules. It's important that you pay attention and remember the classes of the medications, especially for controlled substances, as these may be on the certification exam. For Schedules 1, it's important to know that those have no medicinal use. So Schedule 1s could be anything like heroin or LSD or cocaine. Schedule 2, those are your most commonly for Schedule 2s, those are your most commonly highly addicted medications. Medications such as hydrocodone, Percocet, things of that. Schedule 3 is the next. An example of a Schedule 3 drug could be Tylenol number 3. For Schedule 4, those could be like your sedatives, such as Xanax. And then Schedule 5s are commonly your cough medications with codeine. So it's very important that you pay attention to the drug schedules and the classifications of medications. When you think of controlled substances, remember, the lower the number, the more stricter it is. So C2s have the highest restrictions. When a new prescription is received, these are just reminders. When a new prescription is received, remember, C2s have no refills. For controlled substances 3 through 5, those can have 5 refills within 6 months. So make sure that you remember the refill limits. When it comes to transfer rules, C2s cannot be transferred. C3 through C5s, those can be transferred only once. And it's very important to make sure you remember the length of a prescription for a controlled substance is only good for 6 months. So the day that it was written is only good for 6 months. So now that we've discussed domain 2.2 as it relates to controlled substances and DEA rules, we're next going to go into high yield bucket number 3 as we talk about controlled substance inventory. So anytime any medication is received or ordered, especially when it comes to controlled substances, you want to make sure that you are always checking off the logs. So any mention of loss, theft, or destruction should make you think of documentation, because that's what the DEA will require. So it's important that you remember the DEA forms. So for controlled substances, to order the controlled substance, especially a C2, keep in mind DEA form 222. As it relates to controlled substance inventory, you have to make sure that it's secure storage. C2s are always kept locked away. For inventory, it's always important to make sure the medications are double checked. So you would count quantity twice. If a medication has to be returned or destroyed, that also is followed by documentation. Keep in mind DEA Form 41 and DEA Form 106. When it comes to controlled substance inventory, there are such things as a take-back program. So this could be something that could be mentioned on the certification exam. So it is something to keep in mind. So when thinking about the high yield bucket for controlled substance inventory, make sure you remember the DEA forms as it relates to medication storage and inventory. So keep in mind DEA Form 222, DEA Form 106, and DEA Form 41. So next, as we continue to talk about the high yield buckets, we're going to talk about high yield bucket number 4. So for this particular reminder, you want to pay attention and remember the restricted drug programs. Some examples of restricted programs is going to be the I-Pledge. Remember, I-Pledge is going to be a card that is used for individuals who are taking isotretinoin. And so with the particular restricted drug programs, there are certain restrictions to medications, but within the medication for the I-Pledge, that's really going to fall under REMS. That's more of a REMS medication, which is associated with risk management, making sure that patients are aware of the risks versus the benefits of a medication. For other restricted drug programs, there is a restriction on pseudoephedrine. So there's a certain amount of pseudoephedrine that could be sold each day. Remember, it is 3.6 milligrams that can be sold in a day, but not to exceed 9 milligrams in a month. With the sale of pseudoephedrine, ID verification is required, and the ID also needs to be valid. So if there is a driver's license that is expired, that would not be acceptable if a person is trying to purchase pseudoephedrine. So definitely keep that in mind. There are some extra safeguards as it relates to the restricted drug programs. So if you see REMS or pseudoephedrine, which remember pseudoephedrine is abbreviated as PSE, you should assume that there are some additional federal steps that should apply. So remember, when you are working towards the exam and answering certification questions, especially when it comes to restricted drug programs, no shortcuts. Think it through. Take your time. See what the question is really asking. Don't overthink it. And also, like I like to tell my students, know your numbers. So know the difference between how much can be sold in one day and how much, example for pseudoephedrine, can be sold in a month. When it comes to pseudoephedrine, there is a tracking system. So any medication that is sold, any pseudoephedrine that is sold, there is a tracking of the person who purchased it, the date that was purchased, and so that the system can track to make sure that not too much of it is sold because it is restricted. So now that we've talked about the restricted drug programs, we're next going to talk about the FDA medication recalls. So if a drug is recalled, the correct answer is always going to include removing it from use. So anything that's recalled, remember there are 3 recalls. Recall class number 1 is the most severe. That means as soon as that recall is notified to the pharmacy or notified on the FDA website for recalls, that should be pulled from the shelf. So be familiar with the medication recalls. Class 1 is the most severe. Class 2 is moderate. And class 3 assumes no risk, but it could be something that could be taken off of the market for possibly the taste or the smell of the medication. Always remember, when it comes to medication recalls, the priority is the patient and making sure that the patient is safe. So if something is recalled, especially when you're reading the different questions on the exam, anything that has to relate to a recall, it should be an automatic reminder that this is something that should be stopped being dispensed. This could also include any medications that could even be coming up for expiration. So that could be something that you also want to remember and keep in mind. For medications that are recalled, you want to make sure that they are quarantined, that they are taken out of the dispensing area with the other prescriptions, and then making sure that they are put to the side so that they could be returned to the proper company. So now that we've talked about high yield bucket number 5 regarding FDA medication recalls, we're next going to talk about high yield bucket number 6, which is the drug supply chain. Keep in mind that this is the DSCSA, the Drug Supply Chain Security Act. So in this particular domain, 2.6, is going to be based on drug serialization. Remember, every drug has an NDC number, National Drug Code. So the purpose of this particular reminder is to keep in mind for tracking and tracing. When medications are provided to the pharmacy, there always needs to be a documentation of where the medication came from and how much was received. Everything should always have a documentation to be able to track and trace where the medication came from. And the purpose of this is to make sure that there are no counterfeit medications that could be dispensed to a patient. For product verification, especially when it comes to exam questions and just understanding, We want to make sure whatever medication is received, it matches what's on the manifest or the delivery log. So for product verification, we want to make sure all medications has the name, the strength. Medication should also have a lot number. Every medication label should have a lot number and an expiration. This is going to be a way that you can safeguard to make sure that nothing is counterfeit. And in the event of receiving a damaged package of medications, those should be quarantined. So any type of suspicious product, those should be quarantined. So that's something to look out for on the exam questions in case that comes about. All right. So just to recap, we've gone over 6 high bucket examples. We talked about medication storage, which included handling and disposing of medications. We talked about controlled substances and the DEA rules. We discussed inventory, talking about the different forms for receiving, storage, or loss. We talked about restricted drug programs such as REMS or the restriction of pseudoephedrine. We talked about hazardous and pharmaceutical waste. And then we talked about the FDA oversight in regards to the drug supply chain as it relates to receiving medications. So when you think of federal requirements, here is some examples that I want you to really think about to get your mindset ready for the exam. When you're reading the questions as it relates to federal requirements, think of safety is more important. So safety trumps speed, okay? And pharmacy is not about hurrying up and quickly hurrying up doing something, because that could lead to error. We want to make sure that our main focus and our priority is patient safety. For an exam mindset as it relates to these questions, we want to think it's all about the law. We want to think what's in place. What does the law say? There's a law in place for everything when it comes to pharmacy. So it's more, is what the question asking about more in more aligned with the law, or is it convenience? So when you're reading the questions for the exam, you want to really take your time. Think of scope. Scope matters. You have to know what a technician can do and cannot do. Think of the role that the pharmacy technician plays. Pharmacy technicians assist the pharmacist. So if it's a clinical question, such as a patient is coming to the pharmacy and they have a question about what type of medication they should take for pain, should they take Tylenol or should they take Advil? The technician needs to know that's a counseling question. And so that should definitely be directed to the pharmacist. So you definitely want to make sure when you are getting prepared for the exam, you're thinking about the types of questions, but as it relates to federal requirements, understanding the scope of what a pharmacy technician can do. I recall when I was first learning about pharmacy technician, and I was in a program, one of the things that my pharmacy teacher taught me that still sticks with me: when in doubt, don't. So I wanted to make sure that I posted that here in this presentation when it comes to the exam questions. When you're unsure about something and there is a question that really is trying to get you to think about, should a technician do one or the other, really read the question, analyze it, see what the question is asking. And if it's a question of safety, that's really where you want to make sure that you're not jeopardizing it. So now that I've gone over some examples of an exam mindset, let's next talk about some laws that you must know, things and laws to keep in mind and remember. So keep in mind, Durham-Humphrey, the amendment, 1951, this particular law created the prescription versus the OTC category. This law also created the caution label that's on all prescriptions that says caution, federal law prohibits this federal law prohibits this medication to be dispensed. Make sure you remember which law created that, and that was the Durham-Humphrey Amendment 1951. Another law that you must know is the Kefauver-Harris Amendment 1962. This particular law requires that drugs be proven safe and effective. So there could be a question on the exam that gives a definition, which law does this go to? And you can remember this. Other laws, the PPA, the Poison Prevention, PPPA, the Poison Prevention Packaging Act. This is the particular law that requires patients to sign if they do not want a child-resistant top. So all medications come with a child-resistant top on the prescription bottle, unless there's a signature from the patient that they don't want that. Another law to keep in mind is the 1996 HIPAA, of course. This particular law, HIPAA, HIPAA, Health Insurance Portability and Accountability Act. This is the law that protects patient health information. Over 90, this is the law that mandates counseling is offered to patients that have Medicaid. And then another law to remember is the 2003 Combat Methamphetamine Act. This is the law that requires the restriction of pseudoephedrine, of how much they can have in a day and how much they can have in a month. So these are laws that you must know and remember. Okay, so now that we've discussed the federal requirements and laws that you must know, we're now going to get into some of the common exam traps, what we can look out, what you should look out for, and how you can, build your confidence along the way while you take the exam. So, of all of the high yield buckets that we went over, these are some of the things that you want to make sure that you avoid. So do not fall for these. Do not mix up the DEA forms. There are quite a few of them. So you want to make sure that if you need to create flashcards so that you can remember, if it's easier for you to use a digital study guide, whatever is going to help you connect which form to what it does. For example, to order C2s, you would order form 222. I can connect that with C2s 222, but that's just my example. So you want to make sure you're creating a way so that you do not mix up those DEA forms. Speaking of DEA, make sure you know and remember how to calculate the DEA number. Looking at the two letters, doing the checksum of the 6 digits, making sure that you follow the way it's supposed to be done so that you can, if there was a question that was to ask you if a DEA number is valid or not, you'll know how to do it. Other things to not fall for when it comes to common traps on the exam: do not confuse federal law with state rules. When it comes to the law, we always use the strictest law, and 9 times out of 10, the federal law is the strictest. So whenever there's a question in regards to which law should be followed, we always follow the strictest law. When it comes to things to really make sure you're not tripping over, remember the scope of practice. What are some rules? What are some roles and actions that a pharmacy technician can do? And what are some things that only a pharmacist can do? For example, it's the pharmacist who is responsible and who can do a DUR, the drug utilization review, and the final check verification for medications and viewing prescriptions. Pharmacy technicians cannot do that. So make sure that you're knowing what the role of the pharmacist is and what's the role of the pharmacy technician. Try to make sure when you are reading these exam questions that you pay attention to the words that says always and never. Sometimes those are traps. So when reading the exam questions, take your time. Don't overthink it. Really see what it's asking you and pay attention. Remember, on the exam is multiple choice. So some tips when you are answering multiple choice questions: when reading the options that they have available, 2 questions are definitely not the answer. So that means there could only be two choices, and you have to then do process of elimination. But remember, when it's going about the law, and as we're talking about law requirements, you always want to do which one is leading to patient safety if you have to determine one or the other. Be mindful, don't ignore words that might have must, only, or prohibited in there. There could be a question that says the pharmacy technician must check or must double check their work to ensure that there are no errors. That sounds like a really good way to make sure patients' information and patient medications are being safely handled. So make sure that you're paying attention to those. Be mindful not to fall into the trap of the misleading refill limits. Remember, especially for controlled substances, C2s have no refills. C3 through C5, it can have 5 refills within 6 months. And those prescriptions for controlled substances are only good for 6 months. Non-controlled prescriptions are only good for 1 year. So be mindful of those misleading refill limits. Lastly, but definitely not least, it's important that you don't fall for those choosing helpful answers to break the law. We want to read the question thoroughly and make sure that we're not overthinking it or just going with what the question might be having. So now that I've gone over these examples of the common exam traps and what not to fall for, I've gone over quite a bit in this presentation. Let's now do a rapid knowledge check to see what you remember, to see what, so now let's do a rapid knowledge check to see what you remember and to also see how well you do. So listed on here is the rapid knowledge questions 1 through 5. Let's go one at a time. Which DEA form reports theft? I'm going to give you about 5 seconds in between each one. If you want to get yourself a piece of paper to answer these questions as I go through them, that's perfectly fine as well. Now, keep in mind, on the exam, it's going to be multiple choice, but I'm a fan of asking a question and then you know the answer. That way, whenever you see the multiple choice options, there's no doubt in your mind because you know the answer. Okay, so the first one, which DEA form reports theft? Second question, how many refills is allowed for a C3 through C5? Question 3, which law created the distinction between prescription and OTC? Question 4, what is the daily pseudoephedrine limit? Like, what's the daily strength of pseudoephedrine that a person could purchase? Question 5, how long must records be kept? Ready for the answers? Okay. For number 1, if you said DEA Form 106 is the form that reports theft, that is correct. For question number 2, if you said 5 refills for controlled medications C3 through C5, that is correct. For question number 3, if you answered Durham-Humphrey Amendment 1951, that is correct. For question 4, if you answered 3.6 milligrams is the daily limit for pseudoephedrine, that is correct. For question number 5, if you answered 2 years, that is correct. If for any of these rapid knowledge check questions, if you got any incorrect, that's okay. Go back and review, study more, and again, don't give up. I have more rapid knowledge questions for you. Let's go with rapid knowledge questions 6 through 10. Question number 6. Which DEA form orders C2s? The next question. When does a controlled prescription expire? Next question. Which law requires counseling? Next question. What is the monthly pseudoephedrine limit? And last question. Which controlled schedule has no medicinal use? Ready for the answers? All right. So for the first question, it asks which DEA form orders C2s. If you answered DEA form 222, that is correct. For the next question, when does a controlled prescription expire? If you answered 6 months, that is correct. If for the question where it says which law requires counseling, if you answered over 90, that is correct. What is the monthly pseudoephedrine limit? If you answered 9 grams, that is correct. And for the last one, which controlled schedule has no medicinal use? If you answered Schedule 1, that is correct as well. And again, if any of the rapid knowledge questions that we just did, if you got any incorrect, just write those questions down, go back, review them so that you can, again, add and build your confidence for the exam. So we've gone over a few things. We've gone over the high yield buckets. We've talked about the common traps that could happen on the exam. We talked about the laws that you should know and remember. Now we're going to go ahead and wrap it up with final anchors and some takeaways. So of this entire presentation, 3 things to really remember and keep in mind. It's about safety first. Federal requirements have laws in place to make sure that patient safety is the priority. So when reading the questions on the exam, you want to make sure you are seeing and answering the best option that can align with patient safety. Second thing to remember, know your DEA forms. There's DEA 222, Form 41, Form 106. There's even a Form 224, which is the form that allows pharmacies to dispense controlled substances, as an example. And the third thing to remember, when reading the questions, choose the most compliant option. And in the end, take your time, read each question thoroughly, and you want to make sure that you answered each question with calm and with confidence. So now that you've gotten to the end of this presentation and we've gone over some laws to know, we've gone over some common traps to be aware of, we talked about the high yield buckets, I think you are exam ready. Remember, the point of this practice is to know that you're not memorizing these laws. You're learning how to think, figuring out how the exam may pose a question, and then you're choosing the best solution. So remember, safety comes first because safety is the priority when we are dispensing medications to patients. When testing, remember, you can always stop, think, and choose what's the most safest and what's the most legal action. Take your time. Again, yes, the exam has 90 questions, but you want to make sure that you are reading each question thoroughly and then choosing your best selection. You are building confidence in yourself to know how to reason. So when it comes to the certification exam, you are learning how to think, and you're learning to choose the best option that's going to be safe when it comes to the patient. And above all, you getting to this point in your career where you are ready for certification to become a pharmacy technician, you should know that you belong in this profession. And the patients and the pharmacists and your pharmacy colleagues, we're all waiting for you to just, make that happen. So I definitely appreciate this time with you staying with this presentation. And I hope you walked away feeling confident, feeling clear on the expectation when it comes to federal requirements. And if there are any questions or feedback that you would like to provide, I am available via email, pharmacy.technician.educator@gmail.com. I hope you've enjoyed this presentation, and thank you so much.